Good morning, everyone. My name is Michelle Dufresne. I'm going to be talking to you guys about managing patient care today. Regardless of what type of facility you work in as a staff nurse, you will be responsible for using organizational resources, participating in routine activities while providing patient care directly, and utilizing time productively, collaborating with all kinds of members of the healthcare team. And leadership characteristics will evolve within team members of any unit. So, defining managed care is where we'll start. Managed care is a healthcare delivery system that focuses on decreasing costs and improving outcomes of groups of patients. So, no matter where you work or what type of delivery model is used, you will be trying to achieve a similar goal, no matter where you are. We want to lower the cost of healthcare while providing the best and highest quality care possible while improving patient outcomes. That is our ultimate goal when we are in healthcare trying to take care of patients. So there are standards of care that help define the nursing practice. Professional nurses adhere to professional organizational standards or guidelines. So we, as nurses, look to a Joint Commission, American Nurses Association, and National League of Nursing to define those guidelines. Standards of practice is what I'm talking about. So those are the guidelines that we use to determine what a nurse can do and should do to deliver care safely to our patients. They're also used to define benchmarks of achievement to define desired levels of excellence when we do this also. So accountability in nursing cannot be achieved without clear definitions of what's an acceptable standard of care. So this is how we are held accountable in our professional practice. So the Joint Commission or the ANA and NLN define those practice guidelines for us as nurses. Competency is one of the things that is defined in these standards or guidelines. So what is a competence? Competence is defined as processing the knowledge and skills necessary to perform one's job safely and effectively. It involves having a skill set or being able to have the psychomotor skills to deliver the technical part of care at the bedside. It also involves knowledge, being able to critically think and make decisions effectively at the bedside. And then attitudes, being able to develop those interpersonal skills to connect with our team members and work together to deliver a certain set of care to our patients. So the goals of our practice then are here: health and wellness promotion, illness prevention, health restoration, and caring for the dying. So health promotion is just defined as a process that enables individuals or communities and groups to increase their own control over their health care needs, improve their own health. So we want to have healthcare policies that help us to define that level or competency. And we look to different levels of authority in our society to do that. So what I'm referring to are governmental departments at the local, state, and federal level. So there is where our policies with healthcare are defined, and they have to coincide with our practice guidelines. So they all kind of align together to empower people with the knowledge, attitudes, and skills to promote healthy choices in the end. That's our goal in our practice as a healthcare professional. Illness prevention is every setting that you work in, you're going to be trying to educate patients on how to prevent illness. So that's through making healthy lifestyle changes, behavior modifications, and access to healthcare and medications is all part of illness prevention. Then health restoration focuses on the ill patient and extends from early detection of disease through helping the patient to recover. And then lastly, caring for the dying. We want to help people live as comfortable as possible during the dying process and to support their significant others when they are dealing with death and dying. There are different delivery models of healthcare that we're going to briefly talk about. And what that refers to is healthcare providers and agencies that work together to provide the needs of our patient population with very limited resources. So we want to decrease the cost of care while improving patient satisfaction and improving patient outcomes, healthcare outcomes. We do this with the use of insurance agencies. Today, it's called health maintenance organizations or managed care. So health maintenance organization is just one type of managed care. A PPO is another type of managed care. Point of service is another type of managed care. So managed care is a big thing today that we'll see in healthcare. And that's how we get the resources, financial resources for the needs of our patient population. And unfortunately, many of the groups that we're going to see won't even have access to this type of resource, unfortunately. So that's a big debate today also. So example here of managed care in helping to promote a healthy population, prevent illness, would be delivering vaccinations to our populations. We can do this to people who have managed care options and those who do not have managed care options through our governmental policies that are established in our communities at the federal level, state level, and local levels. They all play a part in providing this type of service to our patient populations, which is very important. The nurse's goal in managed care here is to help provide resources efficiently and to avoid duplication of resources. So that's our role in managed care, collaboration and coordination of healthcare needs. There are different models of healthcare delivery, and so I'm going to define the few that are talked about in your textbook. Case management is the first one. Focuses on ongoing care of patients with chronic disease, long-lasting problems, people who need home health, chemotherapy, things like that. So managed care is, case management is that function, that role or model of delivery of healthcare. The case manager is someone who's appointed to a patient when they're admitted to a hospital system. Their goal is to prepare the patient for discharge. This begins the moment the patient is admitted to the hospital. And we want this to start as early as possible because we want to deliver care efficiently with the lowest cost in mind. So case management is a very important part of our patients who are admitted to hospitals in that sense. Patient-focused care. The nurse learns about the lifestyles, habits, family of the patient, their culture, their religious beliefs, and how this may impact the patient's care in the hospital or whatever service they're in. This is important to look at because this is going to affect how some patients adhere to recommendations or medical regimens. So it's very important for you as the nurse in the bedside to act as this patient-focused model here because we want to encourage a healthy lifestyle and we want to help promote health when they are ill because when they come into the hospital, they're ill. So we need to get the information needed so that the patient will receive the most benefit from the resources that are at hand. Differentiated practice. Differentiated practice refers to the skill set of our medical team within the healthcare system the patient's at. So, example, we will see different levels of nursing care, meaning we have LPNs, we have ADN prepared RNs, we have BSN prepared RNs, we have MSN prepared RNs, we have advanced practice nursing prepared professionals now. So this skill mix is maximized and used in a timely, efficient manner to deliver the best care, the highest quality possible for the patient's needs at the most affordable cost. Shared governance is next. Shared governance refers to the organizational's management style, I'm going to say. It encourages it encourages the healthcare team to participate in decision making along all levels of management. So by doing that, it helps the team members become more committed to the organization and to the vision of the organization. So they have this shared vision, in other words, and the goals are set that are mutually defined by every member of the team in that organization. So that's a shared governance style, and it's pretty much the preferred style that's used in most healthcare systems today. Team nursing. Team nursing refers to forming different groups of teams with a different skill set within that team. So members of the team will have different skill sets. An example would be an RN, an LPN, and a assistant to the nursing staff. So that's one team that will be assigned to a group of patients, and they will deliver the needs of that patient group. The RN with the highest, or the member with the highest competency level, will be responsible for everybody on that team's actions. So they are delegating out tasks to the other members, but retain the authority and responsibilities involved with the care being delivered. So that's team nursing. There are different types of terms in management that you need to understand. When we are managing patient care, you should understand what advocacy means. Advocacy refers to the nurse empowering the patient to know how to take care of themselves and their own healthcare needs. So advocacy, nurses advocate for patients in a sense to protect their rights and defend them from any wrongdoing. The best way to do this is to give the patient knowledge of how to take care of their own healthcare needs. So advocacy is the first term. Clinical decision making is the next one. Clinical decision making is knowing how to prioritize care and in a timely manner to establish the goals of the patient needs. So clinical decision-making, critical thinking is pretty much what we're talking about here with clinical decision-making. So prioritizing care is a process nurses are using to manage time, establish an order of responsibilities, and implement interventions that are needed for your patient. Communication is the next term. Communication is a very important skill set to have as a nurse because we are collaborating with other members of the healthcare team and coordinating the care for our patients, which can take a lot of communication skills at different levels of the healthcare team. Also, it's important because we have to be able to communicate to our patient directly. And in order to empower them and give them information that they need, we need to be able to have those communication skills that are needed. And you've already discussed and studied those skills in the beginning of this semester. Ethics. Now, ethics is important to understand here, especially with our changing population of patients. They're becoming more and more diverse and coming from different backgrounds that may be different than yours. So ethics is important to consider in that sense now, more so than before. They refer to providing patient-centered care. Well, you keep hearing patient-centered care all the time. Well, this is what it's referring to. Understanding that all patients, in accordance with care, should be done in accordance to their common ethical nursing values of being truthful, promoting good, maintaining fairness, and doing no harm. So the principles of altruism, autonomy, human dignity, integrity, social justice are the principles that I'm referring to with this definition of ethics. Altruism is simply being selfless and putting the needs of the other person before your own. So setting aside your own beliefs and values and understanding where the other person is coming from, what their beliefs and values are, and not forcing yours onto that person. So that's altruism. Autonomy is the ability to self-govern, so to take care of your own needs. And that's what we are doing when we advocate for our patient. So the best way to advocate for your patient is to educate the patient. So autonomy is, in a sense, giving them the knowledge that they need to become autonomous with their own care. Human dignity is the right of a person to be valued and respected. So again, understanding that everybody has their own set of beliefs when it comes to health, and understanding their ethical and cultural background is going to help you define their belief about health. So showing dignity and respect for that belief, those changes, those other beliefs and values is important. Integrity refers to being honest, or veracity is a term that comes to mind. Having strong moral principles and demonstrating that in your care for your patient. So that is what ethics is all about in general, in a brief discussion. Your book probably goes into a little more detail and gives you more examples to look at. Healthcare systems. Healthcare systems refers to nurses work with federal, state, and local guidelines in public and private settings in order to prevent illness, promote wellness, and provide palliative care to those who are dying. So that's what I'm referring to with the term healthcare systems. Understanding that we need to coordinate services and provide the most efficient method to deliver care at the lowest cost within these three levels of the healthcare system. Teaching and learning is simply wanting or the need to educate our patient about their healthcare needs and how to promote health and how to prevent illness and help restore health if that's the need at the most efficient way, delivering the highest quality of care at the lowest cost. Okay, so those are important terms to remember and refer back to, as well as understanding the different delivery models of healthcare. We're going to look at now leadership and management styles when we are in the midst of delivering our nursing practice at the bedside or wherever you're going to be. So leaders. Leaders are individuals who use interpersonal skills to influence others and to accomplish a specific goal. There are formal and informal leaders, and most of us are exposed to informal leaders most of the time. But there are specific formal leaders that you need to understand, and we have to adhere to their authorities. So formal leaders are selected and are appointed by organizational agencies and have, with their title, have a certain level of authority to make decisions and to enact policies and procedures and guidelines that we've already talked about. So those are our formal leaders. An informal leader is not appointed. The informal leader is recognized by members of the group, and the group gives that informal leader authority to guide the group. So most of us adhere to informal leaders more than we do sometimes to our formal leaders. We kind of resist our formal leaders a lot more than our informal leaders. So, and that there's some psychology behind that, which I'm not going to go into, but so just to understand the difference in leadership within an organization or a unit where you're going to be working. Managers are always formal leaders. Other examples would be directors, supervisors, administrators. Those are all different types of formal leaders in a facility or a healthcare organization. So there are leadership styles you need to know about. I'm going to go over a few of them. The autocratic leader is the authoritative leader. This person does not believe that the individual is capable of making a decision themselves. And they also understand that people are motivated by external forces. So the general consensus about that is most of us are motivated to do things that we feel will be rewarded by. So that's what the autocratic leadership recognizes, that you're going to be motivated by the rewards of an action and that you need to be guided in order to do those required tasks. A democratic leader is a participative leader. They encourage the group to make the decision, and then they take a consensus, and the decision will be based on what the consensus is. So that's the democratic leader. The laissez-faire leader is self-regulated. They believe the group has a need for autonomy and to self-govern themselves. So that's what they will do. They will allow the group to make the decision. Sort of kind of like the democratic leader, but a lot less strict, a lot more passive leader. Bureaucratic leaders, they do not trust themselves or others or anybody to make the correct decision. So a bureaucratic leader is going to be the one that is going to follow policies and procedures, regulations and guidelines. They do things by the book, in other words. Situational leaders are the leaders that are very flexible in a sense that they understand that the task and relationship, it has to coincide with the group. They understand that they consider the staff member's skill mix needed to or abilities to achieve the task, and they know the nature of the task that needs to be done, and they're very sensitive to the environment that it's going to take place in. So all these things plays a big role in how the decision is going to be made. So it's based on those 4 factors for a situational leader. Charismatic leaders are very rare in management. But those are people who can read the room. They characterized by an emotional leadership between the leader and the group. So they read the vibes of the group, and they use that to motivate the group to action. So those are very rare types of people, but they're very motivating. They can come into a room and get anybody to do whatever they want, in other words, because they know how to read what's going to motivate that group of people to act. Okay? Transactional leaders, they take into account the relationship with the followers based on an exchange for some resource value by the follower. So you can think of transactional leader in this sense. When you go into a business or a place of any kind of business, let's just say that, you're there to purchase a service or an item, and it's the value of that service or item that's going to motivate you to do something. So that's what a transactional leader does. They look at the value associated to the need of a certain task or the goal that wants to be achieved, and they're going to use that to influence people to do certain actions. Transformational leaders are the best, I feel, in my opinion, the best type of leadership. These are leaders that are very creative. They know how to foster creativity, risk-taking, innovation, commitment, collaboration within a group. They understand the importance of a shared vision and goal. So they use that to help motivate people within the group. So they are, to me, the best type of leaders to have in your unit. Shared leadership refers to a leadership style where the leader recognizes that each member of the group is a leader within themselves. So they're going to try and motivate that sense in every member of the group. They want everyone to take on that leadership responsibility, and they want to support that and motivate that kind of action within the members of a group. So that's a shared leadership style. So each of those leadership styles are important to recognize and understand the value of each of them in certain situations. And everyone adopts a mix of leadership styles. You're not just going to ascribe to one type of leadership style. You're going to use a combination of these styles in your own practice as nurses. So the functions of management now we're going to look at, and you can think of it sort of like the ADPI process. So in the beginning, we're going to begin with planning, then we're going to organize, then direct and control. Those are the different terms used. It's a little different than our ADPI, but it's similar in the same sense. So in planning, we establish goals, we evaluate the situation, that's assessing the situation, predicting future trends and events, and then we formulate a plan. And then we convert it into action, we implement it. Organizing refers to the continually process of reviewing our needs. In this sense, we're reviewing the need for human resources and material resources as a manager of any kind of healthcare service. And then directing is a manager's ability to direct, which is based on their power, their authority, and leadership style will also impact directing, how you direct others in your team. Then controlling refers to quality improvement. So we have in hospital systems continuous quality improvement processes that are going to go on. There's different ones. And then there's peer reviews also that are used to control. And what does this impact. It establishes our performance standards. So it evaluates what we're doing and if it's still necessary or if it's even effective. Our performance standards are important to look at and assess as we deliver care. It also determines how to measure performance, creates tools that permit consistent measurements and performance evaluations, and it gives feedback in the end. So we can evaluate the type of care we're delivering, the model we're using, and different things, everything we've discussed, leadership styles that are being used, and ways we can change the delivery of healthcare. So other principles that we have to understand with management involve accountability and responsibility. When we institute our functions of management, ultimately it's going to be our accountability and responsibility that's impacted. So accountability is the ability to assume responsibility for the actions and behaviors that you're doing, and understanding and accepting the consequences associated with those behaviors. That's accountability. Then responsibility is simply having the obligation to perform the task. And with that, you have to understand managing resources, enhancing employee performance, building and managing teams, managing conflict, managing time. All of these things impact the principles of management. So managing resources. As a nurse on the unit you're going to be working, or clinic you're going to be working in, you will be managing resources. You will be managing financially the resources available and the material resources available. So the material resources we can see easily, but you do impact financial resources as well. So in a sense, we have to assist patients to understand how to improve their health care. In that sense, you're managing financial resources of health care, helping to lower the cost of care in that way. And then knowing not to just wastefully use the materials available on the unit is also a very important aspect of managing resources, and you will have a direct influence on that wherever you're working. Enhancing employee performance, your manager's kind of going to be in charge of that, but you could also be a part of that with other coworkers that you're with. So identifying appropriate learning opportunities, facilitating attendance, encouraging achievements of educational goals are things that you can do individually, or your manager will help assist the team to achieve this as well. Building and managing teams. Of course, that's a manager's responsibility. But you have to recognize individual roles and communication styles and evaluating the group as they work together and trying to find ways to improve collaboration within that group and outside of the group, because we have to work with other areas within a hospital system as well. So all that matters with team building and managing teams. So managing conflict involves differing values and philosophies and personalities. So there's always going to be conflict within a group, and we have to recognize that and not take things personally, and understand how to act professionally, and hopefully decrease the amount of conflict that we experience within our teams. So, or within our facilities, because we're going to be looking at other team members within the facilities that you're working with. So we want to always try to decrease conflict within that system. Then managing time. So that just has to focus with setting goals and priorities appropriately. So you need to learn how to prioritize tasks and do things that need to be done first. Recognize what those are, and delegating tasks out responsibly to other team members who can help achieve the same goals. Learning how to ask for help when you need it. That's very important as a nurse in a healthcare system. You can't do everything by yourself. You need to have help at some points in your practice. All right, so we have a few questions to go over, and then I only have one more concept that's real important that I want to get to, and I'm a little over my time, but we're going to go through it anyway. The first question is, during patient rounds, a patient tells the nurse manager that he has not received his medication all shift. Using the skills and competencies of a manager, what will be the nurse's first action? The nurse manager needs to clarify and verify the information as whether it's accurate or not with the nurse who's directly involved with this case. So A is the correct answer. Communication, in this sense, is the most important step first. So discuss the patient's statement with the assigned nurse is the correct answer. The next question. The nurse manager is interested in initiating self-scheduling on the medical surgical unit. Which are stages of the planning process for the initiative that the nurse manager will use? Select all that apply. Okay, the nurse manager plans to develop specific goals and objectives for his or her area of responsibility. A manager identifies and manages unplanned or unexpected events that interfere with getting work done efficiently, effectively, and in a timely manner. The manager must also develop operational plans of implementation, such as acquiring devices and training staff. A plan addresses the questions what, why, when, where, how, and by whom. So those are the correct answers. So A, B, C, and E are the correct answers. Coordination is part of organization, not planning. All right, so the last concept to really discuss is a very, very important concept. Delegation. So delegation is defined by your Nurse Practice Act and also by your facility policy. So the facilities policies have to adhere to your Nurse Practice Act. The Nurse Practice Act is a state law. So they can't change that law, and they have to follow it exactly as it's stated in the law. So the State Nurse Practice Act is very important to understand about delegation. So delegation is the transfer of responsibility and authority for an activity to a competent individual. So that's important to understand what that means exactly. So delegate tasks that you are accountable and responsible for. So as a nurse, you can't delegate anything that is outside of your Nurse Practice Act. You have no authority or responsibility to any action outside of your Nurse Practice Act. That's defined by the state law. So you can only delegate what you are responsible and accountable for. Remember that. So examples of tasks that you can delegate. These are tasks that can be delegated to an unlicensed personnel. So an unlicensed personnel is like a UAP or a PCT, assistant patient care person. So certified nursing assistants, nurse extenders, home health aides, medical technicians, orderlies, surgical technicians, the transfer team in a hospital. Those are all unlicensed personnel that you will delegate different tasks to. So examples of tasks that can be delegated are vital signs, taking vital signs, weighing a patient, transferring and ambulating a patient, postmortem care, baths, feeding a patient, doing INO collection. That's another example. So very important to understand what you can delegate and what you cannot delegate, all right? So what we cannot delegate as a nurse to an unlicensed personnel. You can never delegate assessment tasks, interpreting data, defining a nursing diagnosis, evaluating care, patient education, care of invasive lines, and creating a nursing care plan. So some of them are pretty obvious. Some of them aren't so obvious. So assessing a patient's